There's a reason I call radiation the gift that keeps on giving, but it's not the gift we want. One of the biggest side effects of radiation can take months to appear. I see so many people who are coming to see me once radiation is done, and they are totally confused why they are developing these common symptoms months after radiation is over. Hi there, my name is Beth Hoag. I'm a physiotherapist who has been working in cancer rehabilitation, lymphedema, and pelvic health since 2009. I am also the founder of the online cancer rehab space. In this video, we're going to discuss radiation fibrosis after radiation for breast cancer. Specifically, what it is, what the signs and symptoms are, and what to do if you suspect you might be developing radiation fibrosis of the breast or chest. And make sure you stick around to the end because I'm going to share one of my favorite exercises for radiation fibrosis of the breast and chest. So let's get started. So what is radiation fibrosis? It's a long-term side effect of radiation that often doesn't even start to appear for 4 to 12 months after radiation is complete. And we don't quite know exactly how many people it impacts, but studies are showing approximately 23% of people after breast radiation or chest radiation for breast cancer. We also know that these changes can continue for several years after the completion of radiation. Now, after any injury or even radiation, inflammation is a normal part of the healing process, but radiation fibrosis is different. Think about it like wound healing gone wild. In other words, there's an excessive and a prolonged period of inflammation in the area of the body that's impacted. Eventually, as this process continues, it can cause the tissues to thicken and become less flexible. It can reduce blood supply, and it can increase scarring in the impacted region. So that's what's actually happening on a tissue level. But what does it look and feel like to you if you're starting to develop radiation fibrosis? Well, one of the big common symptoms with breast and chest radiation is that I hear people saying that they feel tight in the region. Specifically, some people say it's like they're wearing an iron bra. Or one of the most common things I hear people is they say that it's like a vice grip around the ring around where their bra strap usually sits. Alongside this, people often notice pain that is progressively getting worse and mobility that is progressively getting worse as well, specifically movement of the shoulder, maybe through the torso, and even sometimes, depending on how long and how severe it is, it can even go up into the neck. Depending on how involved the ribs are, some people find they start having difficulty taking deep breaths. And that's largely because the rib cage really needs to expand and stretch with the inhale and move with the exhale. And with radiation fibrosis, it can start to tether into the ribs and make it really difficult for those ribs to start to separate to take those larger deep breaths. And as with anything else, when we're experiencing progressive tightness and restriction in a region, people often find they're starting to feel weaker in that area as well. You may notice some bogging swelling, which is a little bit different than a post-surgery swelling. And finally, if you do get an injury in the area, it can often take longer to heal than if it were anywhere else in the body. So what do you do if you suspect you're developing radiation fibrosis? Well, first, I think it's important to mention that unfortunately we can't fully reverse this process. This is, as we talked about earlier, a process that happens in the way your body is responding and healing to radiation. And unfortunately, there's no way that we can change that. You needed radiation to treat your cancer, and now what we're working on is how do we start to manage some of those side effects. So we're going to talk about 3 things that you can do to help. First, as with any change in your medical condition, it is always important to seek out medical attention from your family physician or your other healthcare provider to make sure that there are no other reasons why these symptoms can be developing. Remember earlier I listed quite a number of symptoms that can be indicating that radiation fibrosis is present, but there are also other reasons that can happen, and it's really important to get those ruled out first. Second, if you've been following me for any period of time, or if you see me in clinic, you know that I'm a huge believer and proponent for working on the focus of the breath. Deep breathing is a fabulous way to start to work on that rib mobility that I talked about earlier when those ribs start to get a bit viced and compressed. Now, it's beyond the scope of this video for me to go through and teach you how to do deep breathing, but the good news is I have done a couple of videos on deep breathing in the past, and I'm going to put those links in the description box below and strongly encourage you to go back and look at them. In addition to working on the mobility of the ribs with deep breathing is one of the fastest and most effective ways to start to get into our nervous system, calm it down, and to reconnect to our body. And again, if you know anything about the work that I do, is really important, and I believe strongly that it's important to be aware and in your body whenever you're doing any of this type of work, because if you don't know what's happening, it's very difficult to notice any change. And finally, at the start of this video, I did promise you that I was going to share my favorite exercise for radiation fibrosis, and that's what we're going to do right now. It's called the spinal twist. Again, I'm not actually going to teach it to you because I do have another video that I'm also going to put in the description box below. But what I love about the spinal twist is we're working on moving fascia in the chest, in the pec region, in the rib region, but we're also connecting it down to the fascial connections through the hip and putting it together with a deep breath. I just love this stretch. It is such a complex, really simple stretch to do, but really, really effective as well. So make sure you go over to that video because it is a wonderful stretch to start loosening up and moving through the chest. Now, if you've seen your medical provider and everything has been ruled out, you've tried the tips in this video and you're still just not noticing any or even enough improvement, I have a few other options for you. First, if you live in Ontario, Canada, I offer virtual and in-person physiotherapy appointments and consultations, and I will put that link in the description box below. Second, if you live outside of Ontario, Canada, I'd strongly encourage you to reach out and find a cancer rehab physio in your region. Now, if you don't have access to a cancer rehab physio, not to worry. I've been working in cancer rehab since 2009, but recognize that cancer rehab is still an evolving practice and access to cancer rehab is still very limited worldwide. So whether it be due to limited finances or limited geographical location and resources, not everybody has access to getting the support that they need. This is why I created the Breast Cancer Recovery Program, so you can access comprehensive, clear, and expert information and support for how to recover after breast cancer treatment, including radiation fibrosis. Through self-paced videos and detailed handouts, you will learn what to expect as you heal from surgery and go through treatment. Targeted exercise to regain the mobility of your shoulder and your strength. And finally, learning good quality information about things like cording, lymphedema, mindfulness, and pelvic health. If this sounds at all interesting to you, I'm going to encourage you to learn more information, and I'll put the link in the description box below. So that's it. I hope you found this video helpful. If you enjoyed the content in this video, I encourage you to give this a big thumbs up and subscribe to my channel, which is completely free. I invite you to leave any questions or comments in the description box below. And as well, if there's anything else you'd like to learn, any future videos, I'd love to hear from you. And finally, the best gift you can give is to share this video with someone that you think could use this information, because at the end of the day, your quality of life matters. Until next time, be well.